Welcome back to the Now Morning Show. So we started off this Tobago Thursdays on Now with Spotlight with Kimberly talking about the response to the requested budget, and we're continuing the conversation right here, right now. Joining us this morning is Dr. Tsoiafatt-Angus to talk about the response to the requested budget for the Division of Health. Good morning, Dr. Tsoiafatt-Angus, medical doctor, political leader, innovator, and so much more. How are you this morning?
I am great, thank you, Natasha, and good morning to your viewing audience.
It's wonderful to have you with us this morning for this conversation, because this is definitely a critical piece of the request that we need to break down and have some conversations about. So let's get straight into it, Dr. Tsoiafatt-Angus. Tell us, how are you feeling right now, and what are the key things that you've taken away from the request?
Okay, so this was quite an exercise in them coming up with the numbers for this budget. And I know that they prefaced it on the fact that we can get 6.9%, which we are not going to get. No successive central government has ever given Tobago more than the 4.03%, which is by law, even though they can give us up to the 6.9%. And so this is an ambitious budget. But there were some things that, I was kind of disappointed about inside of especially the area of health.
Right.
And number one, when you have such a large health budget in relationship to perhaps your agriculture budget in this day and age, it sends a message that we are not understanding that wellness is the way to go, and therefore putting some more emphasis and balancing the emphasis on wellness and what promotes wellness. And it's not just in the health sector. Wellness expresses itself in other areas of the divisions, and especially in our food area, and we are not seeing that balance and the understanding and appreciation of that balance. Additionally, I felt that there was a missing inside of having the Roxborough hospital actually being put there as one of the key areas to operationalize right now. That hospital has been sitting there probably 2 to 3 years.
Right.
This administration has been in at least 1.5 years, a little over that. And the Roxborough Hospital still has not been operationalized. They see patients in an emergency room, they stabilize the patient and even may send them home. But if that patient has to stay overnight, that patient has to go and be transported to the Scarborough Hospital in order to be an inpatient. And you have a whole building that is supposed to have those services that is still left undone.
So there's definitely some recommendations I'm sure we'll be able to discuss moving forward in this conversation this morning, because what you've mentioned there is critical.
I'm not hearing you. I'm sorry.
Can you hear me now?
No. Could you go a little louder?
Sure, no problem. Can you hear us now? Okay, so we seem to have a few technical difficulties.
Okay, go ahead.
Okay, great. You can hear us now. So just as you mentioned, of course, with the Roxborough Health Facility in particular, it is a critical point of conversation, and it leads back as well to what's really taking place on the ground in Tobago when it comes to access to medical care, availability of resources, and so much more. Now, before we get into any further conversation about that, let's also look at the mention of the Neonatal ICU as well. That has basically been put to the forefront along with the MRI capability and purchasing as well. How do you feel that ties in to what we just discussed with access and availability with Roxborough alone and the Scarborough Hospital?
Well, it tells me that the administration is not looking and analyzing data as it should, and data to drive your development and to drive your next steps. Um, whilst we may have a lot of patients, I don't know how many, may have challenges in terms of requiring a neonatal service, we have to look at all the other parameters. And one of the biggest ones is that right now, Tobago is on a decline, a significant decline in our birth rates. We have dropped by over 100 birth rates annually. And whereas I think we were about 450, we are in the high 200s right now, or low 300s. So it tells me that if you're having a dropping birth rate, there is something going on there that we need to look at. And your resources need to be spent there first before you can add on neonatal services. Because if the birth rate continues to drop, you bring a neonatal service on board, you may not require it as such, you know. And so we definitely need to look at that. When you have a very part-time urologist who comes to Tobago, perhaps it is the time to look at whether it is you have a urologist that is privatized to give more services to Tobago, or you bring one that is full time, because a lot of the men are having challenges, and that is leading to low sperm counts. And also, on the flip side, you also have women who are having a lot of challenges in terms of their hormonal balances and being able to bear children. So I feel that some emphasis has to be placed there. Additionally, neonatal services are, and I'm not even talking about expense of the resources, I'm talking about finding the human resources. I think right now, Port of Spain being the only one, they're looking for a neonatologist. A neonatologist doesn't come like, it's not that easy to find. And the service, for it to be sustainable, we really have to look at what we're doing and where we put the bulk of our resources. If we are not even having regular medication for our non communicable chronic disease patients, there are a lot of patients who cannot get medications. They see the doctor, the medications are not there, or they get a limited supply to take home and come back. When a patient has to consider the transportation to come back and pick up more medications, that too becomes prohibitive. And therefore, those patients are not controlled in their chronic disease process, and they end up with more complications, cardiac, eyes, all of these other complications there. We need to focus more on preventative healthcare and put the bulk of the emphasis there. I see that they have mentioned some aspect of that, but we really need to see more being put in, and we didn't see where medications are going to be sourced and provided, or perhaps giving coupons to our patients who we know cannot afford, so they can get their medications regularly. So these are areas you want to see emphasis on. We haven't heard about the mental health aspect, being addressed coming out of post-COVID. We have a lot of mental health issues in Tobago. I mean, we had them before, but post-COVID, they have worsened. And we did not see mention of the mental health capacity and enhancing that capacity as one of the priority areas. So, yes, it is a bit concerning. And also the fact that we are putting another MRI on the island to um, go out of service within a year. I
Yes.
believe that that service is something that should be privatized, the
Hmm.
imaging service, and we would see patients getting more effective and efficient service in that area. Should we privatize that, we may have to consider privatizing the ambulance service, getting a whole unit to do that. And Tobago has to consider, when you look at budgets around the world, the percentage of your budget to health is never that large as we are seeing it. So there has to be uh, some conversation, some more analysis about where we are going in terms of our healthcare and ensuring the basic needs are there for our patients. You can't get gauze sometimes or gloves in the
Yeah.
hospital, and you want to go up when you can't even get those basic services. So how are you going to maintain the other services you get there? A neonatal
Definitely.
unit is not just bringing equipment in. You need medications too, and you need to make sure that you can sustain a hospital before we begin the add-ons.
Most definitely. Dr. Tsoiafatt-Angus, listening to what you have shared with us thus far, it definitely takes us back to the beginning of our conversation this morning where we spoke about preventative care in particular and starting with wellness. As we spoke about, as you just mentioned with the ambulances, for example, everything just goes back to that exact point. So can you share with us this morning what your stance is on the involvement of the healthcare practitioners and so much more involved in this consultative process for, let's say, the budget, and what can be done, any recommendations in particular?
I love that you put that on the table because this administration has not had any consultative process for this budget. And that is a huge error because you can't sit in a closed office and think, oh, it's a great idea to do this. Where is the consultation with the health sector to assure that we're not just putting something out there to tease the public, that this can actually be implemented? And they have not had these consultations. And I think that has been a grave error with this budget per se. Last year, they opened a portal so that people can send in information. And last year, we said a portal is not enough. Well, this year, they cut out the portal and cut out even the communication with the various sectors in terms of creating this budget. In terms of wellness, and as I said before, wellness does not just present itself within the division of health and social services. Wellness should be guiding even the infrastructural projects. How do we put down our roads? When you're putting down, take for instance, you have walking paths around playing field, great idea. But when you put a walking path in concrete, what you will have over time is an increase in arthritic patients coming out of that area of whomsoever is using it. And so we need to think further when we're doing these things. Right now, a softer turf is what persons would recommend for a walking path around these playing fields and not concrete. When we're looking at our children within the schools, if we are noticing, and there is, and I'm sure it's not just in Tobago, the significance of scoliosis or the bending of the back of our
Yes.
children in adults, the significant increase in back pains and injuries in adulthood in terms of what type of desks and chairs our children are using, their posture, and also the heavy book bags that they are carrying. And so these are areas that we need to start looking at as health professionals, as health policy makers. It has to go beyond the hospital setting. Because if we begin looking at all of those areas over time, we will begin to see a decrease in the overwhelm in the hospital sector.
Thank you so much for sharing that with us, Dr. Tsoiafatt-Angus. You know, I think we could have a much longer conversation about this because there are so many things that do need to be covered. But the one thing I would love to touch on very briefly, because we have roughly 30 seconds left of the conversation, is access to statistics for those who are in the public and want to find out a little bit more, because you did mention, of course, the birth rate and so much more that is on the decline in Tobago. Where do you think we should, or perhaps do you think it's necessary that we get access to that information, and how can we?
I think it's necessary now as part of a mature hospital sector and administration, if we are growing into a maturity, then it is time for us to publish these statistics. And in publishing them, you are involving the people in Tobago in as part of their own health care, taking responsibility for themselves. And then you share with them how they can better manage themselves in as a part of releasing those statistics. I think it's time that we, have those statistics published so we know where we are going as a people, and we could understand when things are put in or when they're not given, or at this time, why we are doing it, in terms of where we are putting the funding.
So
We actually have, I always like to say, there's a saying that says, form follows function. And that function is our statistics or analysis, which should then guide what we're doing.
definitely. Dr. Tsoiafatt-Angus, we are out of time. Hoping we can have you back again soon so we can continue this discussion. Of course, there's a lot going on today, so there will be more to discuss, but wishing you a wonderful day, and thank you so much for being with us this morning on Now.
Thank you, Natasha. Thank you for having me.
All right, that's Dr. Tsoiafatt-Angus just sharing with us, responses to the requested budget and the health care allocation in particular. We have some interesting things coming up on the Now Morning Show talking about a musical, but I can't give away anymore because we did agree mutually at the beginning of the show that we would not. So stay tuned. Marcus is like,
Not me and you, no? Not me